Good afternoon, everyone. Welcome to the Thursday, May 11 meeting of the Emergency Medical Care Advisory Board. I'll call the meeting to order, and there's a flag salute. Sheriff, would you mind doing the flag salute for us?
Salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Ms. Richardson, could you call the roll?
Certainly. Supervisor Maggard?
Here.
Sheriff Youngblood?
Here.
Chief Greener?
Here.
Mrs. Barlow? Here. Mr. Miller? Randy Miller?
Here.
Mr. Noyola?
Here.
Mr. Peters?
Here.
Mr. Surface?
Here.
Dr. Lyon?
Here.
We have a quorum.
Thank you. We have a change to the agenda that we're going to suggest that we make. Unless someone is here, I'll explain that here in just a second. Somebody's here that wants to speak to it. Item 10C was requested to be on the agenda today. The item is entitled EMT Provider Policies. The person that asked it to be on the agenda has requested that we not hear it today. I don't know the reason why, but if somebody is here today to speak to that specific issue, we'll leave it on the agenda and give you an opportunity to speak to us about it. If there's nobody here to do that, then I'm going to ask the board to remove the item at the request of the person who asked us to post it. So is anybody here today wanting to speak to item 10C, EMT Provider Policies? I don't see one. So then I would entertain a motion for us to remove item 10C from the agenda today. Motion. Is there a second? You catch all that? All in favor, please say aye. Aye. Anybody opposed? Great, thank you. Okay, we have some consent items on our agenda. They are indicated with a CA following the item. Item 5 has that. Excuse me while I undo my packet. Item 5, item 9, items A, B, and C, and under item 12, items A and B. Are there any members of the public or the board that would like to pull any of those items for separate consideration? Any members of the public? Then could I have a motion to approve the consent calendar?
So moved.
Thank you. Dr. Lyon. In a second. Thank you. All those in favor, please say aye. Aye. Is anybody opposed? Great, thank you. We don't have a subcommittee report today, but we may have items for public comment. We always set aside a portion of our agenda to allow the public to speak to us about any item that's not otherwise on our agenda today. Are there any members of the public today that would like to address the board about any matter that we're not going to otherwise take up? Okay, thank you. We have no public requests to speak. Under new business, Ms. Richardson, I think item number 10A, the annual ALS Provider Performance Report, is yours to give us.
Thank you. On September 21st, 2006, the Ambulance Ordinance, Chapter 8.12, was enacted. The ordinance established exclusive operating areas that divide up the county for ambulance transport services. Our county is divided into 10 separate EOAs. These EOAs were assigned through the execution of performance contracts with ambulance providers. The Ambulance Service Performance Standards, which were approved by the Board of Supervisors in 2006, outline the requirements that the ambulance services must meet in order to maintain compliance with their performance contracts. Additionally, the Kern County Fire Department implemented paramedic services in the area of Pine Mountain Club, Operational Area 58, which were approved by the Board of Supervisors for implementation March 1st of 2009. They have the paramedic first responders policies and procedures for Kern County Fire Department Station 58 Pine Mountain Club, which includes their performance-based requirements. On a monthly basis, each provider, the ambulance services and the Kern County Fire Department, submit reports to the division for the monitoring of their compliance with the performance standards. This information is compiled and reported to the Board of Supervisors annually. In 2015, your board designated this May meeting as the annual meeting for review of the ALS systems. The division has finalized the following annual reports. EOA 1, Hall Ambulance Service. EOAs 2, 4, 5, 8, and 9 are combined, which is also Hall Ambulance Service, and EOA 11, which is Hall Ambulance Service. EOA 3, Delano Ambulance Service. EOA 6, which is Liberty Ambulance Service. EOA 7, also Liberty Ambulance Service, and OA 58, which is the Kern County Fire Department. Each provider has been given an opportunity to review their respective reports and provide feedback to the division, and therefore it is recommended that the board receives and files these reports. I'm available for any questions.
Thank you for the report. Do any members of the board have a question or comment about what she just delivered to us? Any members of the public wish to make comment? Then could we have a motion to receive and file item 10A?
So moved.
Thank you. Is there a second? Thank you. All in favor, please say aye. Aye. Is anybody opposed? Thank you. Item 10B, the annual EMS system activity report.
Thank you. California Code of Regulations, Title 22, Chapter 12, which starts with Article 4 for the local EMS agency, mandates that we develop a system-wide implementation of a quality improvement program. We do have a quality improvement program that is posted on our website that we have developed, and it includes monitoring the delivery of EMS care to the public. There are certain items that we must track and report on, such as personnel, equipment, supplies, documentation, and such. Health and Safety Code 1797.276 also requires the division to report to the state annually regarding the activities of this board. And it also requires that these reports be submitted to the County Board of Supervisors. The EMS division needed to develop an annual report, and we wanted to develop one that compiled all of the quality improvement activities as well as the activities of this board into one report. So what we've done is we've compiled numerous data elements from over 100,000 EMS electronic patient records, and we also, in cooperation with local hospitals, developed these reports to provide an accurate and complete analysis of our EMS system. This is our first attempt by the division of a report of this kind. We are really starting to ramp up our quality assurance and improvement activities. We hope to see this report continue to grow and evolve as the system dives deeper into the data and the programs that make up our EMS system. We hope that this accurately summarizes the effectiveness of the Kern County EMS system and the activities of MCAB. These reports meet all of the requirements set forth in Health and Safety Code, Title 22 regulations, and follows guidelines established by the EMS Authority. This report contains a multitude of statistics regarding our EMS system that includes everything from demographics of our system to demand analysis based on volume of calls for every hour of each day. We're proud to include this report in your board member packets, and a copy will be submitted to the EMS Authority and to the Board of Supervisors. Therefore, it is recommended the board receive and file the annual EMS system report for 2016, and I'm available for any questions.
Thank you. Do any members of the board have a question or comment about the report? How about members of the public? Okay, the appropriate action is to receive and file. Would somebody make that motion?
Motion.
Thank you. Is there a second? Thank you. All in favor, please say aye. Anybody opposed? Thank you. Next up, well, if you're looking at your agenda, item 10C is the one that we removed, so we're not going to deal with that one because we already decided to take it out. Item number 11 is the director's report. Ms. Richardson?
Thank you. We've been quite busy since February, our last director report to this board. Recently, we've approved ESS Safety as a non-transport EMT provider. Again, they meet specific requirements that we have set forth in policy, and they require oversight from our medical director. Dr. Lyon reviews all of the programs requesting approval for us, and we continue to work with other interested parties to complete the requirements for program approval. So this makes our second EMT non-transport provider approval so far this year. We continue our efforts to increase the number of people in Kern County trained in hands-only CPR. We partnered with Dignity Health to provide hands-only CPR training to 121 students at Centennial High School. Behavioral Health and Recovery Services has also reached out to us requesting more training. Just this past Tuesday, we trained 28 people in hands-only CPR through behavioral health and recovery services. We've also done 2 kind of health fairs. So at Heritage Park Celebration, we had a booth and provided instruction for approximately 32 people. And Safe Kids Day in Wasco, we provided training for 65 people. So in all, from the last MCAB meeting to today, we've provided training for 246 people in hands-only CPR within our community. We also participated in a media event with Public Health, which focused around water safety awareness, and we provided a hands-only CPR demonstration for the media and through live social media. Additionally, we had the opportunity to host a pediatric disaster preparedness and response course. We opened this entire education center to our stakeholders in Kern County and throughout our region, and then we opened it up to state participants as well. This was a 2-day course. It was designed to educate agencies on what should be considered for our most vulnerable population, our pediatrics, when disaster strikes. We had an incredible turnout. I'm pleased that we had great participation from our pediatric facilities, our ambulance providers. Kern Medical Reserve Corps sent volunteers. Behavioral Health and Recovery sent some mental health professionals. So it was a very wide range of participants in this class. It was taught by TEACS, which is Texas A&M Emergency Training Institute. So the course gets funded by FEMA through the Department of Homeland Security, so the course was free for us to host and free for participants. So that was a 2-day course, and I think we all got a lot out of it. We have our work cut out for us in identifying the gaps in our system to address pediatric patient care when disaster strikes. We had a community initiative that we took on through our Trauma Evaluation Committee. So with our Trauma Evaluation Committee, they identified an injury and illness pattern in our community, which was children being injured or dying from motor vehicle accidents who were improperly or unrestrained within their vehicles that they were in. So our TEC, which is our Trauma Evaluation Committee, took this project on and organized a car seat check clinic in a targeted area of our community. But before these committee members were able to do the car seat clinic, it required extensive training, so they attended a 40-hour education course designed to certify them as car seat safety technicians. We also had other members of public health and some members of our stakeholders attend the class as well. And so I think there was about 200 different car seats that they were trained on during this certification course. The end of the course was the actual clinic day where they had their skills tested and signed off by the course instructors. Overall, it was a very successful clinic. The goal of our program was not just to install car seats, but to educate the caregivers of how to install a car seat correctly. So after the technicians demonstrated how to install it, they took it out and then walked the caregivers through installing the car seats themselves, and that way providing community education to make sure that they will continuously be installed properly and children will properly be restrained. And then the technicians would double check the work of the caregivers to make sure that it was adequate. Every car that came through this clinic received this type of education. So in all, we had 64 cars and car seats that we checked. We handed out 23 car seats to the community due to various reasons. Some of them were expired, some of them had missing labels, and even some children arrived with no car seats. The car seats that we used for this clinic were donated to the cause by various stakeholders and organizations in our community. So we're incredibly thankful for the partnership with multiple community members to make this project a success. So we will continue to watch the data, and we hope to see a positive impact in preventing injuries and death, and we hope to organize more of these in the future. So that was a very successful event and quite the feat to pull off. Just a quick update on Pulse Point. As of April 30th, we have now 1,800 people in the community signed up for the app. So that's risen 500 from our last report. And then updating on our NMSIS 3.4 conversion. So there's a pretty big change from the last report that you received. We have most of our providers are 100% compliant now. Liberty Delano, Kern County Fire Department, Station 58, Edwards Air Force Base, and the Borax plant are all connected and submitting data to the division. Hall Ambulance is rolling out the upgrade in increments. They're quite large, and so the division is currently receiving about 30% of Hall's data on the new platform, and that number is expected to increase and grow as the training within that organization on the new system moves along. So it's anticipated that 100% conversion to the new platform will be in the near future. We're still working with Cal City Fire Department to assess their status on where they stand with the conversion to 3.4. And our BLS agencies will be our next focus to get them moved to the new platform as well. I'd like to introduce a new division member, Mr. Daniel Caverhill. You can just wave, you don't have to stand. He's our newest division member. He'll be taking over the trauma programs and air operation programs, BLS provider programs, and public safety first aid. So we're pleased to have him on board. He's just about at 3 months with us. And we hope to continue to see good work from him so far. And that concludes my report. I'm available for any questions, should you have any.
Very good. 40 hours of training for car seats. That must be everything there is to know about a car seat. Anybody have questions or comments from the board about that, about the report? Thank you. Anybody from the public? Okay, then is there a motion to receive and file her director's report? Thank you, Doctor. Anybody? Second. Thank you, Sheriff. All in favor, please say aye. 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 Anybody opposed? Great, thank you. Items 12, A and B are both on consent, so skip down to 13. We offer an opportunity at every meeting for board members to make an announcement or comment or ask a question or place an item on a future agenda during this time. So do any members of the board wish to make any kind of a comment to the rest of us this afternoon? Don't see anybody. Thank you. Item number 14. Our next is announced that our next meeting is scheduled for Thursday, August 10th, 2017, 4 o'clock in this room. The deadline for submitting items for inclusion on that agenda is 2 weeks before. That would be on July 27 at 5 p.m. And if there's any other matters before us that you guys can think of? Okay, then I would entertain a motion to adjourn. Motion. Almost thought you weren't going to want to adjourn there. The doctor, without objection, so ordered. Thank you.